The most recent study is VII, looks at patients who are not controlled on glargine plus oral agents. They were randomized to idaglera or glargine and aspart. So this gets around to something we discussed earlier, comparing a fixed ratio combination of insulin and GLP-1 versus the combination with insulin with rapid-acting insulin. And here you see both were effective in lowering A1C and in fasting glucose and plasma glucose. But in the combination with aspart, you're going to take a lot more insulin, more injections, and get more hypoglycemia and weight gain. So John, what do you think about this, composite endpoint and the fact that, counting hypoglycemia as part of your endpoint is very important?
I agree. And, some of the new recommendations that we just heard about from both EASD and ADA in Orlando at the scientific sessions were picking agents that minimize weight gain and hypoglycemia. And I think these do that. I think the other thing that was interesting that I don't think anyone really expected from this particular set of trials was the way that the slow up titration, as you mentioned, really minimizes the GI side effects. So when I am talking to clinicians, I will sometimes say, if you had a patient who failed a GLP-1, you're on a basal insulin, you want to intensify with a GLP-1, you might not want to hesitate just because they had failed a GLP-1 that has, a nausea rate of 24, 25%. When you look at this particular product and the low nausea rate, this may be a way to tolerate a GLP-1 that they have not been able to tolerate before, perhaps. And so I think it's an interesting phenomenon that came out of all these trials, in addition to what, as you said, some really dramatic A1C reduction combination.